So
when this stuff was removed, Trump was still president. He still had a team. He still had a chief of staff named Mark Meadows. There is some report.
So it's another beautiful Monday. Welcome to Medical Mondays with Dr. O. Tonight, as I've heard some people contact me, we have a very important topic, as all our topics are important. This one is practical. This is something that we all need to know in order to maybe save lives. I am Dr. Tonyo Kwesomi. I'm a family practitioner, HIV specialist, and I'm also an addiction specialist. I work in Maryland. I enjoy medical missions and just discussing important medical information and helping our communities grow stronger when it comes to health. Tonight, we have one of our precious sisters, Mrs. Tokunbo Atewologun, who is a clinical director. He's a nurse who will be talking to us about life-saving ventures and measures. I'm going to leave her to complete our own introduction. And tonight, something is happening that has never happened before on Medical Mondays. So many people unmuted themselves and are carrying on with different things in the background. So I've muted you. Kindly stay muted unless you are talking. Thank you so very much for cooperating. And now I'm going to give the floor to our sister, Mrs. Atewologun.
Oh, wow. Thank you so much, Dr. O. Good evening, everyone. My name is Tokunbo Shade Atewologun.
You have a feedback. And, is your husband in the same place as you?
We're in different locations. Is it better now?
Oh yeah, it's great.
Is it better? Okay.
Yes.
All right.
Please.
Okay. Okay. My name is Tokunbo Shade Atewologun. I'm a clinical instructor from Montgomery College. I'm also a graduate student in the MP school. So I've been a registered nurse for 20 years and also took care of patient. I did a lot of patient care and also administrative role as a manager, supervisor, and a facility educator. So in my free time, I volunteer at the homeless shelter and also participate in the Red Cross, help to check blood pressure and blood sugar and also weight management. So for me, I also do a little bit of home care as a delegating supervisor. So I discovered firsthand that quite a large number of our home care techs and caregivers, including family members, usually unprepared to perform basic life support. And with my experience, some of the caregiver, even though they have the certification card, but they're unable to really perform the quality basic life support. I think somebody is. Okay. All right. Thank you.
Sorry about that.
That's okay, Moni. So this is what prompted me to create an awareness everywhere in our community, even outside the medical ecosystem, such as the training and also going to the coaches and also going to the daycare and the CDL drivers and security personnel. So it's very, very imperative for us when we have people in our house, especially our houses, when we have people come in from, Africa to help to babysit as a nanny or as a caregiver in our home. we want to make sure at least do they know how to give basic life supports to our loved ones, especially our older adults, because I see that it's very, very rampant. That we have someone to come and take care of our older adults. But we didn't really ask a lot of questions. You know, in case something happened to grandma, do you know how to really take care of grandma? Or in case something happened to the baby, do you know what to do for my baby? I know our culture is to, you know, put the baby in our back and rock the baby. And if baby should choke on the milk, what will grandma do? And we know there's an incident, I believe a few years ago, a grandma that was feeding the baby, and the baby choked, but grandma didn't know what to do. Grandma ended up in jail. So this is why this awareness come to be. I'm going to have like few slides to share. Give me 1 second, please. All right. So we know that brain damage occurs within 6 minutes after heart and lungs have stopped working, and person dies within 10 minutes without oxygen. And each minute that passes, you lose 2 million of brain cells. The longer you wait without oxygen, the greater the chance of brain damage being done. So we have a Good Samaritan law, which protects us in Maryland and also in DC. So it's okay. It helps us to protect us for someone to stop, to lend a helping hand to someone in crisis, or somebody that has a car accident. It's an act of kindness for you to wait for the rescue squad or emergency response to be there for you to be able to make sure this person that is in need, you are able to help them. So there are some few things we need to know and to be mindful of. Even our best attempts to help people is, number one, we need to not perform any intervention that is outside the scope of our practice. For example, for me as a registered nurse, I cannot intubate a patient outside the hospital setting. I cannot start an IV or give that patient, that person a medication, even though all the skills I can perform when I'm inside the hospital. And number two, you must not accept anything that has a monetary value. For example, if I help one of my sisters, let's say I help Dr. Ajagbe, and now Dr. Ajagbe was really nice and said, you know what, I'm so grateful you came in, you know, at the time that I had a car accident, and he decided to buy me a nice Gucci bag, and I put a monetary value to that, maybe $500, $600, $1,000, and I got paid for helping to resuscitate or to save somebody's life. So Good Samaritan law will not cover that. So we want to make sure we stay with our scope of practice by not doing anything you are not trained to do, or get a professional help for that victim. So as I was looking at this research, DC has joined 10 other states that they are encouraging people to call 911 to protect a bystander who call for a person in drug overdoses or in drug overdose cases or alcohol intoxication. So it's very, very important, because a lot of people say, I don't want to get sued. I don't want to call anything. Let me just mind my business and be going, because I don't know anything about this drug problem, and I don't want to be part of it. And people are dying. We see a lot of the crisis of people just dying, people walking off and turning their face to keep minding their own business. So DC has the Good Samaritan Overdose Prevention Amendment Act, which was enacted in 2012, and they're working very well with Department of Health to educate the public in order to prevent any fatal drug overdoses. And also, they also implemented the use of naloxone. Mostly we use it to reverse the opioid overdose. So it's pretty much, you don't need any, you don't need a doctor to give you a prescription to get this. You can get this at Rite Aid, Walgreens, and also local libraries. They're giving them for free for whoever needs them in the home care setting. So also looking at the research, it says that according to CDC, an overall survivor to hospital discharge of patient whose event was not witnessed by the EMS was 8.5%. And of this patient who received a bystander basic life support, they had a higher rate of survival of 11.2% than those who did not receive BLS. So it's very, very imperative for us to know how to be able to resuscitate somebody. All right, so why is CPR? So why is basic life support necessary? We have different names for it. CPR, cardiopulmonary resuscitation, BLS, basic life support. They are all the same. We use the word interchangeably. It means the same thing. So we have to be very, very mindful. When somebody gets into cardiac arrest, most of the time we need to call 911. And when we call the 911, we need to be able to tell them the patient is unresponsive. So cardiac arrest happen when it can happen anywhere, and it can happen on the streets. And a lot of the majority of cardiac arrests happen at home. So when a person's heart and lungs have stopped working, the heart will develop this abnormal rhythm, and the heart cannot pump blood the way it's supposed to. Mostly in the medical ward, we call it ventricular fibrillation. It causes the heart to quiver. So, and it can no longer pump blood to the brain, so to the lungs and other parts of the organs. So damage occurs within 6 to 10 minutes. So we need to perform an effective basic life support. So a lot of the time, a lot of my students that comes to me, they will say, oh, we were told just to do hands-only CPR. Is that okay? Yes, it is. But at the same time, if you have the pocket mask with a one-way device is okay, because each breath you take is 21% of oxygen. And each breath you give is about 17% of oxygen, inspired oxygen. So a lot of the hospital now, they're requiring family and also grandma to attend, basic life support class, first aid class, or rescue breathing training before a baby can be released to the family. Because in our days, before they give us a baby, they will ask us to go get a car seat. But now it's not just the parents. They will ask you, do you have any other person that's going to be a caregiver for this baby? So we want to make sure at least while we're discharging the baby to you, you are able to take care of this baby, including grandma and including whoever is in the house with you. And especially for those ones that comes from Africa to have a baby over here. So if they're living with us, and sometimes they might ask us, you need to come with me so that at least you can be part of the care to give for this baby. All right, so what are the signs that someone is having a low oxygen? So mostly we say poor perfusion, meaning there's not enough oxygen being perfused all over the tissue. So most of the time, the first one is the poor mental status, meaning that this person is now aware, it's not cognizant of his awareness, not aware of their surrounding, and they're confused. But when they get to cardiac arrest, they're not talking anymore. And you have to shake them and tap them to see if they're responding or not. And you need to check their pulse. So we have this carotid pulse on the side of our neck over here. So we want to check it. Another thing that I see when we are checking this is we have to be very careful. We're not checking like this. We're not putting our fingers just like as if we want to choke the patient. So just in case they have an autopsy, they don't have your fingers there, that you actually choke this person to death. So you want to use your two fingers just to the side of the groove of the neck for you to be able to check it. It runs bilaterally. So you can check it. If you're on the right side, you check it on the right. If you're on the left, you check it on the left. So you don't ever want to do this to be able to check for the pulse. And you want to make sure you tilt on the head tilt, chin lift. You want to make sure you are making sure the tongue is out of the way so that you can give the breath. I have an instance about a 17 years old that dad got into cardiac arrest and he doesn't really know what to do. And he was compressing on the bed. And he said, I didn't know what to do, but I did the best I can. Compressing on the bed, it's not effective. The best place for us to be able to do compression is a hard, flat surface, which will be on the floor. So we want to make sure that person is on the floor. And if that person is on the obese, if the person is obese, we can also invest in getting a backboard to put under the person, and then we'll be able to compress. And another thing that I see in the hospital that changes are all our bed CPR release. They have a lever there, it's red, and once we pull it, it hardens. Then we'll be able to, and also the dentists are also have those recliners that will be able to help, so that we can have the firm, flat surface to be able to give the basic life supports that we needed. We know the history of Michael Jackson. So he gave the propofol is an anesthetic that he gave. He had the license to do that. But when they check his reference and they check all the certification, they found out that this physician has not had any renewal for the past 5 years. So that's what's one of those things it was deemed. So it's very, very important for us and for us to be able to get certified. And another thing another new thing that they're doing now is if your certification is expired, you will not be allowed to walk. You will not allow you to be able to do anything. You will have to tell you to go back and talk to the HR and things like that, because they take it seriously. And they are requiring the transporters, the housekeeper. We find out that the first person that finds somebody unresponsive is the housekeepers, because they come in there to sweep and everything, looking at Mr. Jones or looking at whoever it is that you're taking care of in the house, and this person is not talking. So, and they are the first person to push the button to help us, to call for 911. And another thing that I see is when we call for 911, what do we ask for? There are differences between an ambulance and also a paramedic. And if there's an emergency, you call and you say you need an ambulance. What's inside an ambulance? An ambulance has an oxygen and maybe EMT, emergency medical technician. And we'll see we use an ambulance to transport a patient from plan A, from point A to point B. Or paramedic can give an advanced they can give a lot of advanced medical interventions. So it's very, very imperative for us to ask for paramedics to be able to help this individual before they get the patients to the hospital. All right, so there's some key differences in adult and pediatric chain of survival. So in an adult, mostly cardiac arrest is often sudden and frequently result from cardiac cause. But in children, cardiac arrests are secondary to respiratory failure or a shock. A shock is pretty much a drop in the blood flow due to a trauma or also a blood loss. So we want to make sure that we are giving enough compression, and also we're giving breath. So there's some differences with the adults and the infants. When we are tilting the head, we want to be very mindful that we're not tilting the head of an infant more than a sleeping position. So like let's say you want to blow somebody's nose. You say tilt your head back, and then you'll be able to blow that, we're able to wipe the nose. If you do that, you're actually closing the airway for the infant. So it's very, very imperative for us to be able to know the anatomy, so that we're thinking we're opening the airway, but we're actually closing the airway for patient. So we're talking about, I want to talk a little bit about the drug overdose, because I have the Narcan over here. It's a 4 milligram, and it comes in 2-pack, and there's sprays. So what are the signs of an overdose? Well, how would you know this person is, it's overdose on a substance abuse? So sometimes you see the paraphernalia that is around, and you see needles, and sometimes you see the drug, and sometimes you see the bottle of alcohol that they got intoxicated with. So it's very, very important to know those signs, which are what? Sometimes sleepiness, difficulty waking up, breathing problem, and sometimes shallow breath. And so these are some of those pictures to tell us the landmark. We'll see when we're ready to compress on an adult, we use the heel of our hand and compress the lower half for 30 compression to 2 breath for 5 cycles, which equals to 2 minutes if you're by yourself. And if you're 2, compressing on an adult is still the same ratio. But it differs when you're working with an infant and children. So if you're by yourself, you give 30 compression to 2 breath, 5 cycles, 2 minutes. Or if you have 2 people working on an infant or a child, it becomes 15 compression to 2 breath. So if we're, I pray we'll be able to revive as many as we can. So they encourage us to put the patient in a recovery position, so which is this position over here. So this position helps to make sure that the vomiters, the patient does not choke on them. So it clears the airway by putting them in this position. Okay, so these are some of the very, very important supplies that we need to invest in having at home. This is a pocket mask, and it has a mask, and you also have a one-way valve in there, one for the adult and one for a child. So we can carry it and leave it in our glove compartments to use. We can get this from Amazon, and they're about maybe $17, maybe max $20 we'll be able to use. And this is a backboard. So just in case you have someone that is on the obese and you're unable to really pull this person down on the floor, and then you can use the backboard to be able to perform the CPR on that person. And this is mostly on the floor, we call this ambu bag. This is the bag mask device, and we can attach this to the oxygen to give more oxygen to our patient. Okay, so I get a lot of questions. How are we going to be able to resuscitate a pregnant woman? Because we don't want to hurt the baby, but still, we still need to be able to do this. So we do not want to delay providing chest compression for a pregnant woman in cardiac arrest, because 2 lives are at stake. So approximately 20 weeks, if that woman is lying on her back, the uterus compresses and the large blood vessels in the abdomen. So the pressure can interfere with the blood flow to the heart, and that is generated by the chest compression. So it's advisable to do the manual lateral uterine displacement, meaning manually moving the uterus to the patient's left side to relieve the pressure on the large blood vessel, which is pretty much, we said, the inferior vena cava. So if the woman is revived, we place her on the left side, which helps to improve the blood flow to the heart and to the baby. So this is just one of those pictures that you can use a wedge, just be able to manually displace the uterus. Okay. All right, these are some life-threatening emergencies that we need to be mindful of. It's a heart attack. So heart attack has been the leading cause of death in US for both men and women. And it says every 40 seconds, a person has an heart attack. Heart attack occurs when there's a blockage. What causes the blockage is what? It's the blood clots. So because it will restrict the blood flow to the heart muscle. So when the blood clots form in the blood vessel, we want to try to call, and we want to call the emergency response immediately, because the longer a person waits to get help, the greater the possible damage to the heart muscle. So what are signs of a heart attack? Chest discomfort in the center of the chest. And some people say that it's a squeezing pain, fullness of pain, lightheadedness. And for women, mostly they complain about jaw or neck or back pain. So what are actions? What are the things that we need to do if somebody is having a heart attack? The first thing is for us to make sure we have that person to sit down and remain calm. We want to loosen any tight clothing that might be constricting. So we want to make sure those clothing are loose. And ask patient if they're using any nitroglycerin. Nitroglycerin is one of those medications. They're little pills, they're vasodilator. They will help to relieve the pain. We want to call the 911. So when we call 911, we want to tell them this is as a result of chest pain. And also, a lot of the 911 will give you orders. We'll give you instructions and say, well, we'll give aspirin 160 baby aspirin low dose of 2 of them, 160 to 325. He said to chew it. Why do we have to chew it? We chew it because we want it to quickly get into the bloodstream faster, and also to prevent the damage to the heart. So what are some of the obstacles to life-saving treatment? What are those things that is preventing us from recognizing that this is a heart attack? So a lot of it is because people will often say, I'm too healthy, I'm too young, I don't want to bother my doctor, I don't want to frighten my spouse. But sometimes the main thing that I hear is an indigestion. I ate some cheeseburger last night with some fries. Let me just take some Malox. That this will take care of it. Take an antacid to neutralize it, then I'll be fine. But what are the system of care that we need to really put in place? Number one, we need to remember time is muscle. Time is muscle. Every minute counts. The longer the victim waits for the treatments, the more damage to the heart muscle. So we need a timely intervention. It's very, very paramount. Mostly the goal from the initial contacts to the treatment intervention, we'll see they say it's less than 90 minutes. So we need to be, proactive in calling 911 and be able to save our loved one. So I want to talk a little bit about stroke. It says every 40 seconds, someone has a stroke in US, and more than 795,000 people, they have stroke. And it's the leading cause of serious long-term disability, and it's the 5th cause of death in US. So what are the warning signs? What are those things, warning signs? So I have the FAST is not as the acronym for FAST. The first one is we want to watch the face, the side of the face. Does it droop or is it numb? Ask the person to smile. So when you ask the person to smile and you see one side kind of droops to the side. And A is the arm weakness. Is one arm weak or numb? So you want to ask them to stretch their hands, have their palms up, and see if one arm drifts downward than the other. So you're checking to see if this is really a true heart attack. But at the same time, we need to call right away. So speech difficulty is speak slowed. You're asking somebody, what's your name? So they're talking like that. That's not normal. So that's this victim is unable to speak or hard to understand. So you want to tell them, ask them a simple sentence. Tell them to say, the sky is blue, and they're saying blue. So that tells you something is going on. And the last part of it is T, which is for time. So it's time for us to call 911 and let them know what's going on with our patient. It's within 3 hours window from the onset of the symptom, so that this person may be eligible for administration of antiplase or thrombolytics, or maybe they end up having thromboectomy, which is a removal of the clot. So this is my last slide. So in recap, I've talked about why is it necessary for us to perform BLS, because we want to save life. We are tied to say breathe, and it's life and death. We need to be able to be our neighbor's helper to be able to call. And also the Good Samaritan law. The Good Samaritan law will protect us so that we're not too scared for us to be able to call for help for somebody else. Also emergency medical response services. So who do we ask for? We want to ask for paramedic because they can give us advanced life support to our loved ones. And the use of naloxone. So naloxone, mostly we use it for opioid-associated cardiac arrest, and we can get them in any of the local drug store, and it's free. We don't need prescription to be able to purchase it for any one of our loved ones. So this is the end of my presentation. Thank you all for listening, and I will wait for any questions. Dr. O, over to you, ma'am.
Thank you so very much. Thank you.
You're welcome.
applaud you because I've never seen anyone deliver a talk like this, CPR, in the way you have done it. It's
Thank
a
you.
difficult conversation to have. It's a difficult thing to explain, especially when you are not performing. The way we normally do this is to perform. So without performing, thank you so much. This is amazing. So
Thank you.
why did we have this talk? Because emergencies happen all the time, and to people who least believe it could happen to them. And usually people are not prepared. What you just heard tonight is what people pay for. And I would encourage you, our sister we just presented actually teaches CPR, ACLS, which is advanced, cardiac life support to physicians, nurse practitioners, physician assistants. If you're interested, reach out, please, in the chat box so that can be set up for you to learn more. So I just want to reiterate some things and then ask some questions that would also help us hone in on reiterating what we just heard. So for home, especially if somebody has weight, it will be important to get a backboard and have it at home. It is not when you have emergency that you're now looking for something to position the person that you need to resuscitate. It will be too late then. So that's the purpose of this conversation tonight. So that if you don't have something like a backboard at home and you think you have people that may have weight, you may want to get one. It is important when people are resuscitating somebody not to do it on the bed. You cannot resuscitate somebody on the bed. They have to be lying flat. So if you can lay them flat on the ground, that's good enough. The pocket mask is another thing to get. Aspirin is good to have at home. And in the United States, we have aspirin, usually 81 milligram is what people usually have at home. If an emergency occurs, somebody is having a heart attack. I need to talk a little bit about that. Heart attack, usually people will complain of chest pain on the left side. They may break out in sweat and they may not. We call it diaphoresis when they're having that. They may have nausea with it or they may not. But guess what? Those symptoms I just told you, or they may have the pain radiating from that left side, from that left chest to the left side of their body. Those symptoms are usually in men and white men. When research was done on this, it was done on white men. White women, Black women, and Black men actually usually present differently. So a woman may present with something that sounds like congestion. They have, something that people will call they have reflux. Mrs. Atewologun actually talked about that people would think they have reflux and start treating, acid reflux. Please get it checked out because it may not be. Women present differently. So with aspirin, I was talking about that 81 milligram, if that's what you have at home, and there's an emergency, you think somebody is having a heart attack, it doesn't hurt. Give them 4 tablets. 4 tablets to the 325 milligrams. You need to do at least 160 milligrams to 325 milligrams. So give 4 tablets. In Nigeria, they have 71 milligrams. You can give 4 tablets too. It will be 284 milligrams or 355 milligrams. They could be life-saving. I want to reiterate that with stroke, the magic window is 3 hours. You want to get that person to the emergency room as soon as possible. You don't want to wait. Time is of the essence. You see somebody's one side droop is the way I can, explain it the most. Please get emergency services. If it's not in the US or in Europe or somewhere where there's 911 emergency services, get them to the hospital. So my question to you, I will ask after I bring Auntie Tawa on. Auntie Tawa, you have your hand raised. Kindly ask your question, ma'am.
Hello, everyone. Can you hear me?
Yes, ma'am. We can hear you, ma'am.
Oh, thank you very much. If someone has heart attack and is by himself or herself, what do you do?
Excellent question. Yes, what do you do?
All right.
I'm gonna add something, or having a stroke.
A stroke. Mm-hmm.
Okay. So if that person have an underlying heart problem, a lot of the time we encourage them to wear an alert button.
Mm-hmm.
So to push an alert button to be able to get someone to come in and help them quickly. And also for someone that have a heart condition, a lot of the time we want them to at least be able to have the medication very close to them, wherever they sit. So at least they will be able to get help. But the main thing is most of the time for them to subscribe to that alert button. So press the alert button, tell them help. That's enough, and everything is already in the system, so they can come to you and come quickly to help. They might have to bust the door open, but at least just to be able to save a life. Thank you for that question, ma'am.
Thank you very much.
You're welcome.
Okay, so if somebody does not have an underlying medical problem, because you know what? A lot of people have high blood pressure. We call high blood pressure a silent killer. A silent killer because they don't have any symptoms. When people show up in our clinics or hospital with a headache or with chest pain, and we check their blood pressure and find out they have high blood pressure and we can intervene, I always dance and I praise God that, you know what? It's good that you have this and we can treat the blood pressure and avert problems. That the headache is warning sign of stroke getting ready to happen, or chest pain is warning sign of heart attack getting ready to happen. So that being said, somebody has high blood pressure, they don't know they have it because they haven't been to the doctors in God knows when, and they don't check their blood pressure and they don't know. And if you don't know, let me tell you something about high blood pressure. Let me tell you something about high blood pressure. High blood pressure can cause, without any warning, heart attack, stroke, congestive heart failure, kidney failure, or blindness, all without any warning. So if somebody does not know that they have that underlying problem, so they don't have the necklace or bracelet that, we recommend that people with underlying medical problems should wear in case of emergency. So what do? They just wake up, they alone at home. We've seen it happen. And one side is drooping. Nobody's at home. Or, they have this chest pain that is out of this world, and they know that they're not feeling right. It's radiating to the left side, and what should they do?
Well, I think I need to look up more to come up with an answer for that. But if you don't have the medical alert and you're alone in a house, the best bet is to be able to find the closest way to be outside and see if you can wave, and hopefully a neighbor can call for you that you having, you know, a chest pain or you need help. So, and I know one of my neighbor, because she saw me with my white coat every time. So one time the baby was choking because she runs a daycare, and she came in banging on my door. So I knew something was wrong. So, and she didn't bring the baby, but she came, ran, and I just ran in there. So, and I just told her what to do. So that's another way that you can do that. But for an adult, I'll say just find a way to be able to get someone around you to be able to help.
Thank you
Thank you
much
for that question.
From experience, I want to share that, you know, if you don't mind, you know, as I've seen one of my patients, I felt like kicking his behind, but I couldn't because I wear white coat. Do you know he drove himself to the emergency room? It wasn't his first heart attack. It was the third one, actually, before we finally found out, you know, what the real cause is. And we've been able to abort it. So he hasn't had one in like 5 years now. But he drove himself to the emergency room. Please don't ever do that. Don't ever do that. If you have aspirin at home, take aspirin. Like I said, Madam VP, are you saying something to, are you trying to say something, Madam VP?
I'm sorry.
Okay, so if you have aspirin at home, please take that and call 911 right away. In fact, as you call in 911, take that. And if it's a stroke, one side is paralyzed, please use the scroll or what have you to your phone if you don't have it and call 911. You have 3-hour window with a stroke. Get to that phone and call 911. Please don't call your son or your daughter or your best friend, because they can't do jack for you then, and it's a waste of time. You want to call 911. You know, I'm telling you this, and I said from experience, because there was a time I was at home by myself and I thought I heard a sound. You know, so I quickly locked my bedroom door, and guess who I called? One of my sons. He yelled at me, "Mom, call 911. Hang up. Call 911. Please call 911. And, you know, that's what I would advise there. I have other questions for you that I noted here. Who exactly should learn how to resuscitate? Who should know how to resuscitate somebody?
Thank you so much, Mami, for that question. I'll say everyone.
Thank you.
Everyone should know how to resuscitate, and especially for those ones for us who are healthcare providers, we can actually resuscitate our loved ones, or do they know how to resuscitate us? So I know I have to tell all my kids and everyone in my family, I'd say, we're having a popcorn basic life support tonight, because if anything happens to me, can any of you save me? Can any of you know what to do? Because we are so much into, we want to save my loved ones. I want to save my mom, and, you know, but can they save us? Because this is a second nature for us as medical practitioners, clinicians. So we know what to do. Because it's like, you know, once we say a code blue, we are all running, we know what to do, we know what equipments to get. For those ones of our loved ones that they're not in that environment, it's very important. Or the transporters, or the housekeepers, anyone that is, you know, that is taking care of a patient should know how to be able to resuscitate anyone. Another thing that I see is everybody's like, oh, I need it for job, but not really for job. It could be in your household. And you say, I'll just call 911. But sometimes we have lizard, and you know, it takes a long time for them to come. So what do you do for your loved ones before they come? So it's very, very imperative for you to at least to be able to do something before 911 comes. Thank you, ma'am.
Thank you so much.
Yeah.
And I want to thank you because my mindset has always been that it is us healthcare professionals that need to know CPR, that need to know ACLS, that need to know how to resuscitate until I talk to you. You know, I didn't say much then, but that is the fact. That is the truth. I'm trying to get this person who, it was after I talked.
Sorry, mommy. I muted you. I was trying to mute that person. So you can unmute you. Unmute yourself, ma. Sorry.
Thank you. Thank
You're
you.
welcome. Mhm.
Yes, it was after I talked to you that I thought about that wait a minute, I can resuscitate anybody in my family. Can they resuscitate me? Thank God my children can, because my youngest one, when he was still babysitting, can you imagine, in high school, he came to me one day and he said, you know what, I babysit all these children. What if there's an emergency, mom? I don't know what to do. And I'm like, whoa. He said, can I learn what to do? I'm like, no, you need CPR. And they learned CPR. But I didn't even think of me though. It was because he asked, was why we did that. Every one of us need to learn how to resuscitate. We need to learn CPR. We need to know what to do in case of an emergency. Emergencies can occur any time. That was my take-home message when I chatted with you. Again, I thank you. Auntie Susan in the chat box wrote, deep breaths with a deep cough at the end can help in case one is alone. That is true. Do you know, please Google this, Respirate. It's a machine that is used naturally to treat blood pressure. A lot of people don't use it, but what does it do? What does the machine do? You can do it yourself. You don't even have to buy the machine. It's breathing exercises to control blood pressure. You take deep breaths and you breathe out slowly. Blowing it out through your mouth slowly. And you continue to do it for like, I think it's 15 to 20 reps at a time. You can be driving in your car and do that. You'll be surprised when you take that deep breath and you breathe out slowly. It also gives you a calm. It does something to your heart. You can feel it, and it decreases blood pressure. So deep breaths are very important. And yes, she's right. In case of an emergency and somebody is alone, taking those deep breaths and then coughing at the end of it will help and get emergency help. Dr. Jagbe, you can unmute, sir.
Yeah, the physiology behind the deep breath is converting the sympathetic nervous stimulation to parasympathetic. Once you are able to move the condition away from the sympathetic, the blood pressure comes down, and the release of cortisol also will be reduced, which is what causes the blood pressure to go up. So deep breaths, deep, slow breaths are very, very important in that kind of condition. It actually reduces anxiety at the same time.
Thank you, sir. I like the end part of it that it also
Dr.
reduces
O,
anxiety.
if you have a Fitbit,
Sorry?
if you have a Fitbit, the watch, the Fitbit watch.
Yeah.
Do you have an accent? Can you understand? Yeah. It helps you. There's a breathing.
You are cutting off. You are breaking off.
I'm sorry, my phone, bad service. very
Yeah.
bad service.
Talking
Okay,
about
we can hear you again. Fitbits, yeah.
Yeah, the Fitbit has an app on it that does the breathing, because I do it when I'm driving. It will just
Fantastic.
lower. Yes. So if anybody has the watch, what is it called again? iWatch. Yeah, it has it there. It's one of the health matters thing.
It's fantastic. It reduces anxiety. As I showed you how to do it now, you know, I felt a sense of calm. It does that when you breathe out slowly. It does that. Dr. Craig wrote that deep breaths also is significantly of value in persons having a heart attack. Yes, and that's in the context that we're talking about the deep breaths. If somebody was alone and there's nobody there, and even if there's somebody there, they should take the deep breaths, because it's still very helpful. Those early interventions are critical and timeless. I mean, just so important. Okay, so I have another question for you. You showed us how to intervene in children. We use those two fingers.
Yes.
And in adults, we use our
The heel.
the heel of the head, like that.
Yes, the heel. You lock it and put the
Like
heel
that.
down. Yes.
Yeah. Okay.
Yes.
So the person is now resuscitated, and
Yes.
they have pulse, and you're waiting for emergency services to arrive. Is it the left side we should put them on, or the right side? I think it's the left, right?
Yes, it's the left, but I was also doing research. They were saying, I mean, according to AHA, they recommended for us, it's a recovery position for us to position a patient on the left side, because a lot of the time, even evidence-based shows that sleeping on the left side improves oxygen. So, and also for us to make sure when we put them on the left side, the main thing is to make sure this head is supported, so that if there's any vomiters, the person does not choke on that. So for us to be able to clear the airway, to make sure that they do not choke on it.
Thank you so much. She's amazing. Oh my gosh. Look, all the doctors on this platform would echo what I just said, that the presentation she gave, boom, 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 like that, most of us cannot give it like that. Because CPR is not just, is what you actually show. You're showing it and you're talking. But she was very clear. She spoke in plain language and understandable. Amazing. Do you know that some people may not die of that heart attack because you've revived them, but they may now die from that vomitus when they choke on it? So critical. And I don't know if you missed what she just said. When you even sleep regularly, it's better to sleep on your left side. Your heart is on that left side. It's better to sleep there. Dr. Famuyiwa wrote in the chat box that in the App Store, you can get Calm app, CALM app. And that, that's also something helpful. And by the way, I've gotten some requests for Mrs. Atewologun's contact information, and I have sent her numbers out. If you need to get CPR training, which we all should, or you need your staff to get trained or recertified, please let us know so you can contact her and get your training. Any other questions? Any questions? Because guess what? I'm in South Carolina celebrating my aunt's 70th birthday party. I took the time out because guess what? My Medical Mondays family is so dear and so important. But I'm sure they're waiting for me downstairs. because I'm the one who dances from the beginning to the end. Ooh, and they're missing me right now. You can see I'm dressed up for the party. I enjoy the cocktail hour. So any other questions? Uh-oh. A
What's
phone
our
number?
phone number?
Dr.
Yes.
Jagbe, I'll send it to you. You want me to put it in the chat box?
Or you can send it to me directly.
I'll send it.
Thank you.
You're welcome, sir.
Yes, Doctor. Oh, this is Shade. Can you send the link, please, to where this CPR and first aid can be taken? Because I need some of staff to take the classes. I don't know if you have it locally in California as well.
You're in California, right?
That's correct.
Can you
Yeah,
email
go to
me?
Red Cross. Red Cross. Red Cross.
Can you email me, please?
Yes.
So that I can get
Dr.
you
O.
contact there. Yeah, I know,
Dr.
man.
O, Red Cross does it. It's very, very simple. Let her
Okay.
Google Red Cross. Yeah, Red Cross. That's a job.
Okay. Thank you.
You're welcome. It's very important. Please don't let's take this lightly. It's not by accident that we thought this up. There was an incident that was shared with me. Is 17-year-old attack. He died because the children did not know what to do. Auntie Tawa is smiling. She's a nurse. You unmute, man.
Your phone was dying. It was
My
like
phone?
phone.
My phone?
Yes.
I'm not on my phone. I'm on my laptop.
Oh, whatever it is saying. That's
Really?
That's why I was laughing.
Really? That's interesting. My laptop is fully charged.
It's probably not you, Dr. O. If Auntie Tower has T-Mobile, T-Mobile is the one acting up. It's not you.
I don't have T-Mobile. It's not my.
Oh, okay.
I'm not on the phone. I'm on desktop.
But Dr. O is sounding great, vibrant as usual.
Hey, please share some of that to me, Dr. O. Sometimes it freezes.
Really? I think you may be on your end. I think
It may
you're
be,
good.
it may be Wi-Fi.
It may be.
Yes.
Maybe.
Because for
Yeah.
a minute I couldn't hear you either.
Really?
Yes.
Is this place, South Carolina? You know, my Wi-Fi did not work, did not cooperate. So I had to use my phone for internet. And right here, they said their internet has been dropping. So I wasn't going to even try that. So sorry about that. If you didn't hear me, I don't think you missed much. Mrs. Atewologun has covered everything. The reason why I reiterated some of the things she said is because CPR is not that easy. And, you know, some key points I felt, you know, maybe, you know, reiterating would help us to see the importance of what we need to pay attention to, plus things we need to have at home in case of emergency. By God's grace, we won't have any, but it's just good to be prepared. Dr. Lawal just told me that they have trainers in Los Angeles County who can assist with training with small fees. Sister Shade, what part of California are you? so we can know where you need to go. So when you're able to unmute, let us know.
Yes,
Dr.
yes,
Craig?
sorry.
Yeah.
Yes,
What part of
either
California?
LA or Los Angeles or Orange County, either one is okay. I have
Okay,
two locations.
Okay, I'm going to connect you to Dr. Lawal. So please email me and I'll connect you to her.
I'll do that. Thank you so
Okay,
much.
fantastic. Dr. Craig, go ahead. You have your hand raised. You're muted. We can't hear you. You are not muted, but we cannot hear you. Dr. Craig, sir, we still can't hear you. Or is it me? Can you hear him? We can't hear you.
No, we can hear you.
Oh, it doesn't know what is going on.
You can put it in the chat. Maybe we can.
Put it in the chat.
Okay, let's see.
Maybe it's a long thing.
Yeah, that is interesting. I think it's not just on his end. A lot has been going on with different people's phones. Yes, Dr. Lawal just said, I look stunning in the African attire. Do you all agree?
You look pretty.
Yes.
We'll do, Dr. Lawal.
Yeah, good call, Dr. Lawal. She always looks stunning.
Thank you. Thank you, sir. Thank you, Attorney Williams, sir.
I think this must be a South Carolina effect because she even has the big earrings on.
Yes, so it's my aunt-in-law actually, 70th birthday party. I'm so excited. You can't hear the music?
No.
Oh, wow. That's why I have my earpiece on. Okay. Auntie Tawa, go ahead. You can ask your question.
Mrs. Atewologun.
Yes.
You said something about Narcan.
Yes, ma'am.
Can it be used for anything besides the drug overdose or anything? If somebody is having seizure or having any other thing, can we just use Narcan?
Actually, it's just for opioid. It's used for opioid to reverse opioid, any kind of opioid. If you have
opioid overdose.
Opioid overdose. Yes, morphine, oxycodone, hydrocodone, and all the codons, and also heroin. Yes.
Okay. Thank you.
You're welcome.
And it's very easy to use.
Just break it.
It's actually important. We actually carry it now because you never know where you find somebody that has overdosed. For people like me who work in Baltimore, you never know. And it's not just Baltimore, it could be anywhere. Opioid use is widespread now, unfortunately, and we need to be prepared.
So we can use it for propofol too, right?
No,
because propofol is an anesthetic, so it's like more of a muscle relaxant. So pretty much not in that class. It has to be one of those Schedule 2 drug. Yes.
Can I say something?
Okay. We have an anesthesiologist here.
Okay.
Who is the pro and champion in the question you're asking us.
Yeah.
Dr. Buka, you have the floor.
Yeah, Narcan is mainly for respiratory depression. So that's what we use it for. The narcotics cause respiratory depression. And so it's not really for propofol.
But they do use it because, propofol depresses the respiratory system.
No, you may have to bag.
She's saying that you have to bag that person.
You bag them?
I really can't say much of what, but Narcan specifically is for respiratory depression. Sometimes it can be
You're fading off.
What's going on?
You're fading off. Something's going on.
When there's too much narcotics at the end of the case, we give a little bit of Narcan. And Narcan also carries up your blood pressure, but I guess because the people who are overdosed, their pressure is low too. So you don't have that problem. I remember Narcan only goes for a certain length of time. Sometimes you have to give it again.
Yep.
Yeah, but I guess the opioid people are so depressed that you could just push 0.4. We usually give like 0.1 at a time. But the main reason is for respiratory depression. Propofol may end up becoming respiratory depression because it goes to the brain, but that's not what, we don't use it for propofol. You just ventilate them and they'll come up. That's all I could say. They're just nutshell.
Thank you so much. That's the expert in what we're talking about. So the beauty, the gift we have on Medical Mondays, where, we have the experts for each field. Dr. Craig said, extraordinary important presentation. Again, that is the truth. Excellent. BLS and ACLS should be should be standardized in schools and organizations, given the number of baby boomers. That is the truth. That is the truth. And you know what? Every one of us, let's see how we can make the move in our areas to see how we can get this into schools. For me, I have the tool. I have Mrs. Atewologun that I can always call on and say, hey, this school has agreed that you should come train the children. For each one of us, we can do that, see what resources we have. The Red Cross, like Madam VP said, Dr. Lawal has resources in California, and see how we can penetrate the schools, and also family members, because if you learn, can somebody else resuscitate you? Can you be saved if you are in that position? So thank you so much, everyone, for an extraordinary evening. This has been loaded, succinct, but loaded. And I'm very grateful for our amazing presenter tonight. Thank you. And thank you, everyone, for your contribution. So till we meet next week, keep on dancing and keep on smiling. Take those deep breaths.
Thank you so much.
Take the deep breaths.
Thank you so much,
and
everyone,
exhale slowly.
Yes.
Okay. Thank you. Have a blessed